Welcome to another episode of Connect with KB. You know, as always, and I say this to you, that I'm so happy to have you tuning in as we talk about education and leadership, business, and all the wonderful things that connect us to each other. My guest today founded the nonprofit Eye Care for Detroit to provide low-cost, high-quality eye care access for homebound Detroiters. In collaboration with international company eyeglasses.com, their goal is to eliminate barriers to preventative eye diseases and provide vision resources to those most in need. I want to welcome to the podcast Cleamon Moorer Jr. Cleamon, thanks so much for being with me, and I think I'll call you Clem if that's all right.
Absolutely. Thank you so much for having me, Kristen.
You are so welcome. And I got to tell you, I just so admire the work that you are doing. And it is so impressive. I want to hear all about Eye Care for Detroit. But first, Tell me the Cleamon Moorer Jr. story.
I am going to make that a short story, Kristen. I don't want to bore any of your listeners out there. Kristen, I'm a young man that grew up in inner city Detroit, son of entrepreneurs. My family had a collision shop on the west side of Detroit. I attended Detroit Public Schools, went off to become an engineer after getting trained at GMI in Flint, which is now best known as Kettering University. But along the way, Kristen, I had some eye health issues. I was born with congenital cataracts, and they got increasingly worse over the years. So by the time I was 21 at GMI, I was legally blind. My family did not have the economic resources nor the insurance to afford cataract removal. So we were fortunate enough to get the surgery covered by the Sinai Guild. So Sinai Grace Hospital, the ophthalmology department, took care of my eyes when I was 21, and I made a vow to my late mom prior to her passing that I would certainly pay it forward. In fact, she made it a requirement that I paid it forward, and it helped out others that struggled and have the same eye health challenges.
Well, you know what? I think that so many times that people's and their passion ends up being something that has touched them deeply. And obviously this did touch you deeply. It touched your mother deeply. And I admire that you are honoring her memory by doing this. Let's talk then about Eye Care for Detroit and how did it get started? Obviously because of the fact of your history, but let's talk a little bit about where things are right now.
Absolutely, Kristen. Yeah. So Eye Care for Detroit is a new startup, 2022, fresh 501c3. It is the sister company to our for-profit company, American Advantage Home Care. So there's that home care dimension and connection where we've realized over the last several years that a lot of our homebound patients have yet to get eye care services in their home. And then, of course, the pandemic and further isolation further exacerbated not only some of those health comorbidities like diabetes and the like, but also glaucoma and other eye diseases. So we realized that, hey, there's a big gap. And then we did some research on the gap, and Dr. Goyo from Wayne State University and the Kresge Eye Institute led a study over the last several years called the Vision Detroit Project. So in her study, she was able to identify various barriers such as transportation and costs, insurance challenges and issues that decrease the access that many seniors and underserved residents of Detroit have to eye care. And then that homebound community, it's its very own segment that we know a lot about through American Advantage. So we decided to say, hey, let's mitigate some of those barriers. Let's develop a referral tracking system to connect patients, families, and caregivers to eye care professionals who are willing to go into homes and take care of those patients. Let's offer a shuttle service to pick up patients, as well as develop a mobile eye care clinic, so mobile eye care units to peruse neighborhoods and senior buildings and take care of folks in the comfort of the places that they call home. So we are so excited about the developments, Kristen.
Well, Clem, I think the opportunity for you and your wife, Nicole, to start American Vantage Home Care, and that's headquartered in Detroit, Dearborn, correct?
Yeah. Yes.
Yeah. How did that experience lead you here too? And are there a lot of synergies between the work that you're doing?
Yeah. So yes, Kristen, we started Partners in Wellness Management LLC in 2019, and we used Partners in Wellness Management to acquire American Advantage. American Advantage had been around since 2012, but it primarily served Muslim families in Dearborn that were directly referred from local providers. But we saw a greater need to expand that footprint throughout Southeast Michigan and even into the mid-Michigan area to see if we could take care of more patients.
Well, I'm sorry, go ahead.
Yes, Kristen, but as you take care of patients, you find out that there are more needs than what's on a referral. And we wanted to dive into finding ways to partner with other wellness entities to begin addressing some of those needs.
Well, I suspect that you found out, too, that there were a lot of people who wanted to get on board and wanted to be of help. And, I want to talk a little bit about those folks and who they are, because I had an opportunity to review your website a little bit, and I saw that. But I think that this really is just on the cusp of starting to really grow and the financial commitment that you're getting from people.
You got it, Chris, and I am very pleased. Had some longtime friends, the founders of Garden Fresh Gourmet, the late Jack Aronson and Annette Aronson. Annette still provides funding and support through the Artichoke Garlic Foundation. So taking care of people was always near and dear to the heart of Jack, and obviously Annette still. So Annette was a front runner in making a seed donation for our organization. Some local ministers and pastors who have patients who are, or better yet, members of their churches who are also patients that are concerned about eye health. So we had some clergy to make some contributions. And then it continued to get better from there. Emily and Henry Ford III have made a generous donation to support our work. And last but not least, Mark Agnew, the CEO of eyeglasses.com, has made an in-kind commitment or pledge to provide 40,000 high-quality frames to 40,000 homebound patients in Detroit. So those frames retail through the Eye Care for Detroit network at $17 in honor of Detroit's birth year of 1701. But normally, Kristen, those frames would retail for $52 or higher. So his $35 discount to the city of Detroit across 40,000 frames is an in-kind donation of $1.4 million.
Well,
so
it's just incredible. It really is. Have you already started? Are you finding people? Because I have to believe that it is a quality of life game changer for people. You know how that is. I mean, I can remember there was a point in time, I don't have them anymore, but I had contacts, and I think it just messes with all of your senses when you don't have your contacts in. I sometimes felt like I couldn't hear very well. And so I just have to believe that it is a game changer for people.
It will certainly be a game changer for people as it continues to spread, Kristen, because we understand as individuals age, they become more susceptible to decreased or blurry vision, whether that be through cataracts or glaucoma or any other eye health ailment. And it takes away the ability to, read prescription bottles, read the Bible, read the Quran, even watch their favorite television show. So we understand the quality of life that vision or enhanced vision brings to all of us, and we don't want to forget those folks that are sick and shut in their homes and don't necessarily have the ability to go into an optical center or to go into an ophthalmology or optometry clinic to be taken care of.
Absolutely. I can remember years ago that I went to school with a young man that he said that for the first 10 years of his life, he said, I really needed glasses, but we didn't realize that I really needed glasses. And he said when he finally got them and he looked outside, he said, oh my gosh, the trees have leaves
Yeah.
He couldn't even see that. And he said he cried when he saw that. And so that's what I mean from a game changer for people about so much better clarity and, to see a smile of a face of someone that you love. You know what I mean? This is just the work that you're doing. Really, I'm going to say it again, is incredible. Let's talk, too, about how this is going to happen. You mentioned it earlier, some telehealth appointments, in-home visits, mobile clinics, shuttle services. Talk about that.
Awesome. Yeah, so on our website, iCareForDetroit.org, there is a referral platform where caregivers, as well as primary care physicians or social workers, even family members, or the patient themselves can create a referral. So an individual can say, hey, I'm homebound, and I believe I got the following issues or challenges. Here's a little bit about my health background. And it's a HIPAA-compliant platform where individuals submit information, and that information goes into a network of providers, where providers who have subscribed to iCare for Detroit, participating members, are able to identify a patient that they believe they could take care of, whether that's in office to say, hey, I got capacity for more patients at my practice, or I go out every second Saturday of the month, and I could put you on the schedule to come out. So it's a matching service of sorts. And in addition, Christian, we work with insurance companies to get folks who are uninsured or underinsured connected with insurance programs, whether they be Medicare or Medicaid, the traditional, or some of the commercial versions of Medicare and Medicaid. So we understand the importance of the finance that prevents a lot of patients from going the extra mile to learn about how to improve their vision.
Have you found that, and I see where the mobile app, the prototype, won a Techtown Detroit Start Studio MVP People's Choice Award. That too is impressive. Is the app up and running at this time?
Well, Krista, it's a desktop or phone version, so as opposed to just going the full app route, we decided to make it accessible to anyone that wants to save that thumbnail on their phone. So no special login, or don't have to go to the App Store or the Android, Google Play Store to get it. You can just go right to iCareForDetroit.org and begin to engage with eye care professionals real time. Got it.
You know, you mentioned it earlier, you're getting some great support from people. What kind of resources do you need going forward?
Well, going forward, Christian, great question. As we think about the case management that's involved, the additional financial support of helping to offset some of the expense for patients who are uninsured or underinsured, we've itemized support at $250, so $250 donations per senior. That could really go a long way with closing those gaps for a patient, where we know at the very least a patient could get screened, could get 1 or 2 eye exams, and a pair of glasses, all within that $250 donation. So as we think about the thousands of folks out there in Detroit, 40,000 homebound, we understand that ticket could easily be $10 million in order to provide the type of eye care that homebound patients need. So we are excited and open about launching a campaign. And Kristen, that title of the campaign is Make a Simple Decision, Give the Gift of Vision.
Oh, that's great. That is great. Let's go through this again. How would someone get involved if they needed, the process of vision care or to become a patient? And let's just kind of walk through that so we can make sure the listeners know it.
Awesome. So they could always call us, call our number, 313-644-3233. That's 313-644-3233. And 3233 is ECFD, I Care for Detroit. Or visit our website. And our web address is www.icarefordetroit.org. So I Care for Detroit is all one word, and the I is EYE. But we like to use the homonym, Christian. I care for Detroit. You care for Detroit. We all care about the I care of Detroiters.
We sure do. Clem, you know what? I got to tell you, a big pat on the back to you and the great work that you're doing. I'm going to continue to follow along here and watch the progress. I tell you what, before the end of the year, you can count on $250 from Kristen Belzer to go towards a donation for I Care for Detroit.
So kind of you, Kristen. Thanks so much. And I'm sure there's a deserving senior out there that would greatly appreciate it.
Absolutely. It warms my heart. I want to thank my guest, Cleamon Moorer Jr., I Care for Detroit. He's doing championship work, and that mother of yours was first class. I got to tell you, I love her. You know, she raised a good son.
Wonderful. Thank you, Chris.
You bet.
So sweet.
You bet. I want to also thank my supporting sponsors, Dowding Industries, Governmental Consultant Services, AF Group, Public Affairs Associates, and Mercantile Bank. You can listen to all my podcasts at connectwithkb.com. Until we connect again, go live your best life. I'm your host, Kristen Belzer.